So as we move on to this lecture, we're going to talk about this idea of occlusal trauma. So occlusal trauma, you can think about it as what happens when this idea of mutually protected occlusion is violated, right? So what happens when we don't have this anterior teeth and posterior teeth working in harmony with each other? What we're going to find is that we're going to get trauma to the periodontium from functional or parafunctional forces, causing damage to the attachment apparatus of the periodontium by exceeding its adaptive and reparative capacities. So this may be self-limiting or progressive. Okay, so the part I want to highlight is this idea that it's exceeding the adaptive and reparative capacity of the periodontium. So we can think of the periodontium as sort of the complex that attaches the tooth to the bone, right, or the supporting structures of the tooth. So it includes the PDL and then the bone that the PDL is connected to. Okay, so if we were to exceed the adaptive capacity of that, well, we're going to do some damage to some of the structures there. Okay. So occlusal trauma we're going to split up into two categories, and the first one we're going to call primary. So the idea of primary occlusal trauma is that it's induced by abnormal or excessive occlusal forces acting on teeth with a normal periodontal support. Okay, so I'm going to make an analogy, sort of like make an analogy to a tree. So the way you want to think about occlusal trauma is if you have a tree with a root, occlusal trauma is when you just push on this tree with enough force to start to move it, right? So you have normal root structure that goes into the ground that supports it, but the amount of force that you're putting onto it is damaging. So imagine you got like a tractor and you're running over this tree. And we're going to contrast that with secondary occlusal trauma. Okay, so secondary occlusal trauma is when the effects of occlusal force are acting on teeth with a decreased periodontal support. So going back to this tree analogy, this is as if you're digging up the dirt around a tree and you're minimizing the amount of root structure. Well, if you've dug up enough of the dirt around it, it doesn't take much force for you to start to move that tree. Okay, so the key here, the key differentiating factor between primary and secondary occlusal trauma is really the amount of root structure or bone that is surrounding the root structure. Okay, so the minute you have this loss of periodontal support, that's then now causing movements or trauma to the teeth, we're going to call this secondary occlusal trauma. Okay. So what happens when our teeth begin to become traumatized? Well, what we're going to find is pulpitis, or the inflammation of the pulp structure. So a lot of times patients will come in and they'll complain that, oh, my tooth is extremely sensitive now because that tooth has been overloaded over time. Okay. Another thing you're going to find is you're going to see mobility of the tooth. So as you take your finger in an instrument and you start to move the tooth in a side-to-side motion, you're going to find that that tooth moves beyond sort of its normal physiologic limit. Okay. Another thing that you'll find is this idea of fremitus. So how do we differentiate fremitus from mobility? Well, fremitus is the idea that if you were to tap your teeth together and if you were to put your finger onto the side of the tooth, you can feel the vibration of that tooth as that opposing tooth comes in contact. Okay, so fremitus is patient-induced closure that you can feel, whereas mobility is when the practitioner is the one providing the force and testing for excessive movement. Okay, so a classic example of when you would feel fremitus is if you had, let's say, a filling that was done recently, and they left that filling too high, right? So that when you close together, that first tooth that touches is the one that you just had the filling on. So as you clench or close down and tap your teeth together, obviously the tooth that has that high filling is going to take on the brunt of that force, and you're going to feel that tooth vibrate, or you're going to feel it in fremitus. Okay, so that's what fremitus is when you can feel the vibration of the tooth as the patient taps their teeth together. Whereas again, mobility is when the operator is the one testing and moving the tooth side to side. So another thing that you're going to find as teeth become traumatized is a widening of the PDL. So remember, occlusal trauma occurs when you have exceeded the adaptive capacity of that periodontium. And when that happens, the supporting structures, aka the PDL, become traumatized, and you're going to get a widening of that periodontal ligament space. And this can be seen in radiographs where that space now is more radiolucent because that space now is much wider. Okay, so the 4 signs and symptoms that you'll typically see associated with occlusal trauma is going to be pulpitis, mobility, fremitus, and widened PDL. Now they don't all occur, you're not going to see all 4 of them necessarily at the same time. You may see 1 or 2 signs of this when you examine somebody's occlusion. Okay, so it's not an all or nothing principle. You may see a combination of these things. All right, so just a quick note about mobility. We're going to categorize mobility into or classify it into 3 different sections. Okay, so from your perio lectures, you'll remember that the average width of the PDL is about 0.17 millimeters or 170 microns. So that's sort of the physiologic norm that you can move a tooth. So that's within normal limits. Okay, so anything beyond that, so we'll say anything above 0.2, but less than a millimeter of movement, is going to be a class 1 tooth mobility, where anything greater than 1 we're going to classify as class 2. And the differentiating factor between a class 2 and a class 3 mobility is going to be this idea of being able to axially displace this tooth. So not only when you're moving it side to side, but when you then push down, if the tooth moves in an apical direction, then that becomes a class 3 classification. Okay, so that's the differentiating factor between class 2 and 3. Alright, so let's just point out some examples of, or a clinical example of primary occlusal trauma. So remember, primary occlusal trauma occurs when you have heavy or excessive forces but normal bone support. Okay, so that classic example again is if you have a high filling, that tooth, that one tooth that has a high filling is taking on the brunt of all the vertical loading because that's the only tooth that's coming in contact. The other teeth aren't in contact because that one tooth is built higher or taller than it should have been. Okay. The picture that we have here is another classic example of when you'd see primary occlusal trauma, or the excessive forces. Okay. So what we see here is the loss of posterior support, meaning that again some of our posterior teeth are missing. So if we're to start to put all of this together and think about the principles that we learn about, right? So mutually protected occlusion is when posterior teeth protect anterior teeth. Well, the minute that we've lost our posterior teeth, right? So these teeth are missing or have been extracted, then our anterior teeth become overloaded. These anterior teeth aren't accustomed to taking on the brunt of forces in a vertical direction. Okay. So in this particular example here, we're going to see the CJ, and I don't have the radiographs here, but we're going to say that the bone levels here are actually within normal limits. Okay, so that's the assumption we're going to make in this case, is that the bone levels, or the periodontal support of this teeth, is normal. We haven't lost any bone, but what we have lost is the loss of posterior support. So we've seen enough teeth, or we are missing enough posterior teeth that now the anterior teeth are being overloaded. And the sequelae for that is, if you were to look at the patient in a side profile, you can see that the anterior teeth are starting to flare forward. So again, remember the signs and symptoms of occlusal trauma. Well, we said what? Pulpitis, mobility, fremitus, and widened PDL. So think about, if teeth are mobile, they're going to start to move. And the widened PDL allows for greater movement or displacement of that tooth, and then that is going to result in flaring of the teeth in an anterior motion. So you can see that when this patient, I would guarantee before she lost all her teeth, those anterior teeth here were actually in a more vertically placed position. Where now, since she's lost posterior support and is undergoing occlusal trauma, primary occlusal trauma, we're going to see that the results in the flaring of anterior teeth or movement. Okay, so that's one of the sequelae that you'll also see with occlusal trauma. Okay, so let's jump into an example of secondary occlusal trauma. So just as a reminder, secondary occlusal trauma describes a situation in which the forces exerted on a tooth are normal, but that the loss of the periodontal support of the tooth results in the tooth becoming traumatized. Okay, so again, think of that tree example. If you dig up enough dirt around the tree, well, that tree is going to be easy to move. Okay, so in this example, let's highlight a few things that are indications of occlusal trauma. Well, we see a diastema form here. So a diastema just describes a gap between teeth. Okay, and again, we can see a supereruption of teeth. So if we were to compare the CEJ of this central incisor versus lateral, you can see that obviously the lateral has migrated incisally. So there's been supereruption or movement of this tooth. Okay, so if you take a look at and also in the mandibular anterior, you have a similar movement of tooth. You can see that there's an uneven occlusal plane if you were to map out the gingival margins of these teeth. Generally, in a healthy, stable mouth, you would see that the gingival margins would be uniform or more straight across. Okay, so all these things point to the movement or migration of teeth. So the fact that a diastema has formed indicates most of the time that teeth have migrated. Obviously, supereruption in occlusal plane or uneven occlusal plane are all clues that teeth are starting to move. Okay, so if you were to look at this patient's radiographs, you would find that there's been some loss of that periodontal support, or bone loss is what we would see in this radiograph. Okay, so if we were to draw a line where the bone used to be, so if you were to take radiographs at this patient when they're, let's say, 20 years old, you would find that the bone levels would be at the line of this white dotted line. Okay, and over time what has happened is the patient, due to periodontal disease, has lost bone in a vertical direction. So again, this is analogous to digging up dirt around a tree. So now this tooth is going to be, or these teeth are going to be susceptible to trauma because they just don't have enough support. And another sign and symptom, of course, is widening of the PDL. So if you look closely, we can see areas of the teeth in which they're being overloaded. It's beyond the reparative or adaptive capacity of that periodontium. Okay? All right, so just a summary slide to compare and contrast primary versus secondary occlusal trauma. I'll just reiterate this real quickly. Primary occlusal trauma is induced by abnormal or excessive occlusal forces, but the periodontal support around the teeth are normal. In other words, no bone loss around the teeth. Whereas the secondary occlusal trauma is affected by normal forces, but acting on teeth with decreased periodontal support. So you're going to find that secondary occlusal trauma is associated with periodontal disease, when you've lost the bone that holds your teeth sturdy or stable. Okay, so if you visual learners, we'll just have this little diagram for you. So we're comparing forces. Primary occlusal trauma has greater forces, but normal periodontal support. And again, the two classic examples of primary occlusal trauma are going to be a high filling or the loss of posterior support, meaning the loss or the extraction of many posterior teeth. Okay, and then secondary occlusal trauma, normal forces but decreased periodontal support, so the loss of the periodontium around it. Okay, so that's just a summary slide of occlusal trauma. We're going to wrap up this lecture with this question of, well, okay, let's say our patient has occlusal trauma. Well, how are we going to treat occlusal trauma? So when it comes to primary occlusal trauma, we're going to reduce the excessive forces. So in those two examples that we painted, a high filling, well, how do we reduce forces on that tooth? Well, it's as simple as adjusting that filling so that it is to its normal contour, meaning that after you've adjusted that high filling, that all the teeth now, the neighboring teeth, all come into contact evenly. Okay, so again, that's a principle of mutually protected occlusion, or the equal distribution of forces amongst all the teeth, right? Each roll of those teeth have, or each of those teeth have a role in a protective factor. Okay, so we want balanced contact points around all the anterior teeth, balanced contact points amongst all the teeth, but mainly the posterior teeth serve as a protective factor of those anterior teeth to prevent the overloading of it. Okay, so in the other example, we have posterior teeth, or the loss of posterior support, right? So this example where a lot of your back teeth have been taken out. So if a lot of your back teeth have been taken out, well, how can we reduce the force on the anterior teeth? Well, it's as simple as, or maybe not as simple, but the principle is, well, let's replace the back teeth. So there's different ways in which we can do that, and you're going to learn about multiple ways to do that as you get into more of your classes in your second year. So a couple of the ways that you can replace back teeth or increase posterior support is, well, let's put some dental implants in there. So if we put a dental implant, we can connect a crown to it and in a sense replace that tooth that was extracted. Another method of replacing the back tooth is to give the patient a removable partial denture. So we give them a removable appliance that they're able to chew with. Okay, so something that comes in and out, that clasps onto the few teeth that they still have in their mouth. Okay, and another thing that you can do is, if they have enough back teeth, right, if they just lost a few, you can possibly connect multiple posterior teeth together via a bridge or a fixed partial denture. Okay, so those are all ways in which we can reduce forces, is to replace the teeth that are missing, either via implants, a partial denture, or a fixed denture, aka a bridge. Okay. All right, so let's talk about how we treat secondary occlusal trauma. So we know secondary occlusal trauma occurs when you've lost the periodontal support on the teeth. Well, if you were to tie those teeth together or splint them together, then that acts to distribute the force a little bit more evenly around the teeth that you do have. So again, think of this tree example, right? If you have multiple trees in a line that have lost a lot of the dirt around them, well, what if you connected all those trees and braced them together? Well, now all the teeth can share and more readily distribute the force amongst all the teeth and help protect it from damage. So that's the same principle here. So you can see in this picture here that the lower teeth, or the lower anterior teeth, have a moderate or significant amount of bone loss. So these are mobile, but if we were to tie them together with a composite splint, so there's composite that's binding all these teeth together, then that helps protect the teeth and reduce the chance of occlusal trauma. Another example is if you have multiple teeth, you can make a cross arch splinted prosthesis that ties all these teeth together, again to distribute the force a little bit more evenly amongst the remaining teeth that they have. Okay, so to treat secondary occlusal trauma is to how we treat secondary occlusal trauma is to splint the teeth together.